Shantanu to take you through the dorsal lumbar spine in prone position, draping for that.
Right. So for prone position, very important is to make sure there is no pressure onto the abdomen. Because if it pressurizes, then pressurize the IVC return and there are issues with the blood pressure. So your abdomen should be free. At the same time, it should support the body nicely. So these are the slides, initial slides, which are showing you how the drapes are going to be proceeded. And this is our area of surgical interest, which is depending on your length of the incision is exposed, and all four sides are draped. So the video shows making sure that whenever the patient, or this is our volunteer which is sleeping, is having an adequate breathing space and abdomen to move in normal fashion. The lower part of the body and the upper part of the body is covered with two different plastic sheets so that it gives a good cover and isolation to the spine area. One big sheet is used in the lower half, another big sheet is used in the upper half. So what is remaining now are the two sides. Your incision is going to be the central zone. So two sides of the body and the spine are covered with a folded big medium sheet, but making sure that the ends almost go down up to the floor, covering the entire surgical table. So once the all four sides are initially draped with the single cloth drape, we used another cloth layer, giving a double isolation of the surgical area. The final drape is now used for isolation from the anesthesia team as a curtain, and a adhesive surgical drape is now put across the surgical zone. An extra layer is covered from the surgical zone up to the foot before the lines and suction and everything is connected. Okay, so this is very important that the surgical zone is well exposed and well covered depending on the surgical incision. So we are coming to the end of the presentation and our surgical video book. I would hand over for Khadilkar sir for final remarks. Yes, sir.
Okay. So thank you very much, Shantanu, for the wonderful videos and the commentary. So once again, I would like to thank OrthoTV and Dr. Ashok Sham for giving us this opportunity and taking the pains to compile these videos and allowing us to launch this video book in this prestigious Pune trauma course. So thank you, Ashok, once again. And good night. Shantanu, if you want to say a few words.
I think this will be very useful for surgical residents, and getting the basic right, basic things, basic knowledge, basic procedure rights is the first and foremost step for a good surgical behavior in the life. Thank
also,
you.
OT personnel would benefit from this, I feel. Not only the residents or junior orthopedic surgeons, but the OT personnel who scrub or wash up for the surgeries. I mean, even they should be made to watch this and make them aware of the nuances of the draping techniques.
Okay. Thank you.
Thank you very much. Thank you.